Hello, and welcome to this webinar on OSHA's COVID-19 Vaccination and Testing Emergency Temporary Standard. This webinar is intended to help employers and workers familiarize themselves with the requirements of this standard. In issuing the Emergency Temporary Standard, also known as an ETS, OSHA has determined that workers who are not fully vaccinated face a grave danger from COVID-19 in the workplace. The agency has found that an ETS is necessary to protect workers. The basis for these two findings are discussed extensively in the preamble to the ETS, which is available on both the OSHA website and also at regulations.gov website. Paragraph A of the standard addresses the purpose of the ETS. The first reason the ETS was issued is to establish the minimum requirements for vaccination, vaccination verification, face coverings, and testing, all of which OSHA has determined are necessary to address the grave danger of COVID-19 in the workplace. The secondary purpose of the ETS is to preempt state and local laws that interfere with employers' authority to require vaccination, vaccination verification, face coverings, or the testing of workers for COVID-19. The ETS is effective immediately upon publication in the Federal Register. The ETS also has compliance dates for employers. All provisions other than testing will be enforced by OSHA on January 10th, 2022. Testing for employees who have not received all doses required for a primary vaccination series go into effect on February 9th, 2022. Topic 1 of this webinar addresses the scope and the application of the ETS. Paragraph B of the ETS addresses scope. The ETS applies to all employers who have a total of at least 100 employees at any time that the ETS is in effect. This standard generally covers employers in all workplaces that are under OSHA's authority and jurisdiction, including industries as diverse as manufacturing, retail, delivery services, warehouses, meatpacking, agriculture, construction, logging, maritime, and certain healthcare settings. In light of the unique occupational safety and health dangers presented by COVID-19, OSHA has established this coverage threshold of at least 100 employees for 4 reasons. First, OSHA is confident that employers with 100 or more employees will be able to meet the standard's requirements promptly, as the emergency addressed by the standard necessitates. OSHA is less confident that small employers can do so without undue disruption at this time. Second, this coverage threshold will enable the standard to reach 2/3 of all private sector workers in the nation, providing them with prompt protection. Third, the standard will tend to reach the largest facilities where the most deadly outbreaks of COVID-19 can occur. And fourth, the 100 employee threshold in this standard is comparable with the size thresholds established by congressional and agency decisions in analogous contexts. This rule applies to employers with a total of 100 or more employees, except where the workplace is covered under the Safer Federal Workforce Task Force COVID-19 Workplace Safety Guidance for federal contractors and subcontractors, or settings where any employee provides healthcare services or healthcare support services when they are already subject to the requirements of the Healthcare Emergency Temporary Standard, that's 29 CFR 1910.502. The provisions of the ETS also do not apply to employees who do not report to a workplace where other individuals such as coworkers or customers are present, or to employees when they are working from home, or to employees who are working exclusively outdoors. Paragraph C of the ETS contains definitions. Some definitions are discussed later in the presentation, but 2 important definitions that will be covered now are COVID-19 test and the definition of fully vaccinated. A COVID-19 test in the context of the ETS means a test for SARS-CoV-2 that is cleared, approved, or authorized, including emergency use authorizations or EUAs, by the U.S. Food and Drug Administration, also known as the FDA. These tests are in order to detect current infection with SARS-CoV-2, meaning a viral test. The definition of COVID test also means a test that is administered in accordance with the authorized instructions, and also that the test is not both self-administered or self-read unless observed by the employer or an authorized telehealth proctor. Examples of tests that satisfy this requirement include tests with specimens that are processed by a laboratory, point-of-care tests, for example, tests conducted at a doctor's office, urgent care facility, or pharmacy, tests that are proctored over-the-counter tests, and tests where specimen collection and processing is either done or observed by an employer. Fully vaccinated means a person's status 2 weeks after they have completed their primary vaccination with a COVID-19 vaccine if the required waiting time between doses has been met, where applicable. The vaccine must be approved or authorized for emergency use by the FDA or listed for emergency use by the World Health Organization, also known as the WHO. Vaccines that were administered as part of a clinical trial in the US can also be acceptable. It should be noted that there are additional requirements in the ETS for these clinical trial vaccines to be considered acceptable for vaccination. This ETS also permits mixed dose vaccinations that are often referred to as heterologous vaccination. And again, additional details are found in the ETS. Topic 2 of this webinar addresses workplace controls for COVID-19. Paragraph D requires employers to establish, implement, and enforce a written mandatory COVID-19 vaccination policy. A mandatory vaccination policy is an employer policy requiring each employee to be fully vaccinated, other than those employees who fall into one of the following 3 categories. 1, those for whom vaccine is medically contraindicated. 2, those for whom medical necessity requires a delay in vaccination. Or 3, those who are legally entitled to a reasonable accommodation under federal civil rights laws because they have a disability or sincerely held religious belief, practice, or observance that conflicts with the vaccination requirements. OSHA strongly encourages employers to implement the mandatory vaccination policy required under paragraph D1. However, paragraph D2 provides an exception to the mandatory vaccination policy requirement for employers who instead establish, implement, and enforce a policy allowing employees to elect to undergo weekly COVID testing and wear a face covering at the workplace in lieu of vaccination. To ensure that employers' vaccination policies under paragraph D are comprehensive and effective, the policy should address all of the applicable requirements in paragraph E through J of this standard and how the policy will apply to new employees. Paragraph E of this standard requires employers to determine the vaccination status of each employee and also to maintain records of each employee's vaccination status and to maintain a roster of each employee's vaccination status. The employer must collect this information for every employee regardless of vaccination status. For those employees who are fully or partially vaccinated, the employer must preserve acceptable proof of vaccination. All records maintained in accordance with paragraph E are subject to the applicable legal requirements for confidentiality of medical information. In particular, the vaccination status record and the associated roster must be maintained as employee medical records. These records and the roster are not subject to the retention requirements of 1910-1020 D1L, but must be maintained and preserved while this ETS remains in effect. Paragraph E2 defines what acceptable proof of vaccination status means for the purposes of this ETS. Under the ETS, the following are acceptable proof of vaccination: the record of immunization from a healthcare provider or pharmacy, a copy of the US CDC COVID-19 vaccination record card, a copy of medical records documenting the vaccination, a copy of immunization records from a public health, state, or tribal immunization information system, or a copy of any other official documentation that contains the necessary information. To be acceptable as proof of vaccination, any documentation should generally include the employee's name, the type of vaccine administered, the date of vaccine administration, and the name of the healthcare professionals or clinic site that administered the vaccine. In instances where an employee is unable to produce one of these forms of acceptable proof of vaccination, a signed and dated statement by the employee will be acceptable. The employee's statement must attest to their vaccination status and attest that they have lost or are otherwise unable to provide proof required by the standard. Such attestations must also include a specific statement with language provided in the standard that declares that the information is both truthful and accurate. OSHA recognizes the possibility that an employer may have already collected information about the vaccination status of their employees, including proof of vaccination, prior to the effective date of this ETS. When an employer has ascertained employee vaccination status prior to the effective date of the ETS through another form of attestation or proof, and they have retained records of that ascertainment, the employer is exempt from the requirements of paragraph E1 through E3. Particularly, the employer is not required to reevaluate the vaccination status for fully vaccinated employees and is permitted to use any record of response, even if it is not listed as an acceptable proof under the ETS. In such cases, the employer is still required to create a roster for each employee's vaccination status and required to maintain proof of vaccination and the roster as employee medical records in accordance with 29 CFR 1910-1020 while the ETS is in effect. This exemption applies only to the employees whose fully vaccinated status has been documented prior to the effective date of the standard. If the employer has not ascertained employee vaccination status prior to the effective date of the ETS, then all requirements of paragraph E would still apply. Paragraph F addresses requirements for employers' support of vaccination. OSHA has determined that vaccination is the single most efficient and effective method of protecting unvaccinated workers from the grave danger posed by COVID-19 in the workplace. Despite the robust protection against COVID-19 that vaccination provides, many individuals have not yet received the vaccine. Although an individual's decision to receive or not receive the COVID-19 vaccine may turn on several considerations, removing the logistical barriers to obtaining the vaccine is key to encouraging workers to choose vaccination. One such barrier for many employees are concerns about taking off work time to receive the vaccine or to recover from any potential side effects. To address this barrier to vaccination, paragraph F provides that employers must support COVID-19 vaccination by providing each employee with reasonable time, including up to 4 hours of paid time, to receive each primary vaccination series dose, as well as reasonable time and paid sick leave to recover from side effects experienced following any of the vaccination series doses. The paid sick leave to recover from side effects can be in the form of an employee's already accrued sick leave, if available. If the employee does not have available sick leave, leave must be provided for this purpose. OSHA strongly prefers that employers implement written mandatory vaccination policies because it is the most effective and efficient workplace control available for preventing the spread of COVID-19. However, this ETS is also necessary to protect workers who remain unvaccinated through required regular testing, the use of face coverings, and removal of infected employees from the workplace. This is to protect other workers from the greater likelihood that unvaccinated workers may spread COVID in the workplace. Under paragraph G, employers must ensure COVID-19 testing for each employee who's not fully vaccinated and reports at least once every 7 days to the workplace where other individuals such as coworkers or customers are present. Unvaccinated employees must be tested for COVID-19 at least once every 7 days and provide documentation of the most recent COVID-19 test result to the employer no later than every 7 days. In situations where an employee does not report to a workplace where other individuals are present during a period of 7 or more days, the employer must ensure that the employee is tested for COVID-19 within 7 days prior to returning to the workplace and provides documentation of the test result to the employer upon return to the workplace. The ETS does not require employers to pay for any costs associated with COVID-19 testing. However, employer payment for testing may be required by other laws, regulations, or collective bargaining agreements or other collectively negotiated agreements. The ETS does not prohibit the employer from paying for costs associated with testing. The agency leaves the decision regarding who pays for testing to the employer. OSHA expects that some workers and/or their representatives will negotiate the terms of payment. OSHA has also considered that some employers may choose to pay for some or all of the costs of testing as an inducement to keep employees in a tight labor market. Other employers may choose to put the full cost of testing on employees in recognition of the employee's decision not to become fully vaccinated. It is also possible that some employers may be required to cover the cost of testing for employees pursuant to other laws or regulations. OSHA notes, for instance, that in certain circumstances, employers may be required under the Fair Labor Standards Act to pay for the time it takes employees to be tested. For example, if the employee testing is conducted in the middle of a work shift. The subject of payment for costs associated with testing pursuant to other laws or regulations not associated with the OSHA Act is beyond OSHA's authority and jurisdiction. When an employee has received a positive COVID-19 test or has been diagnosed with COVID-19 by a licensed healthcare provider, the employer must not require that the employee undergo COVID-19 testing for 90 days following the date of their positive test or diagnosis. This provision is specifically intended to prohibit screening testing for 90 days because of the high likelihood of false positive results that do not indicate active infection, but are rather a reflection of past infection. Where employers implement a vaccination policy that allows employees to choose to provide proof of regular testing and wear a face covering rather than get vaccinated, the employer's policies and procedures to implement this temporary suspension of testing must be included in their written workplace policies as required by paragraph D2 of this ETS. Under paragraph G4, the employer must maintain a record of each test result required to be provided by each employee under paragraph G1 of this ETS, or which is obtained during tests conducted by the employer. These records must be maintained in accordance with 29 CFR 1910-1020 as an employee medical record and must not be disclosed except as required by this ETS or other federal law. These records are not subject to the retention requirements of 29 CFR 1910 D1I, employee medical records, but must be maintained and preserved while the ETS remains in effect. Employers can substantially reduce disease transmission in the workplace by removing employees who are confirmed to have COVID-19 based on a test or diagnosis by a healthcare provider. Regardless of vaccination status, the employer must require each employee who is COVID-19 positive to notify the employer of their COVID-19 test result or diagnosis promptly. The employer must immediately remove from the workplace any employee, regardless of vaccination status, who receives a positive COVID-19 test or is diagnosed with COVID-19 by a licensed healthcare provider. OSHA has determined that directing an employee who tests positive or is diagnosed with COVID-19 to stay home until return to work criteria are achieved is critical to preventing the transmission of COVID-19 in the workplace. After an employee has been removed from the workplace as required by paragraph H2, the employer must ensure that they do not return to the workplace until the employee meets the return to work criteria. An employee is allowed to return to work when the employee receives a negative result on a confirmatory test, such as a NAT or a PCR test, following a positive result on a COVID-19 antigen test, or the employee meets the criteria in the CDC's isolation guidance for return to work, or return to work is recommended by a licensed healthcare provider. Note that this ETS does not require employers to provide paid time to any employee for removal as a result of a positive COVID-19 test or diagnosis. However, paid time may be required by other laws, regulations, or collective bargaining agreements or other collectively negotiated agreements. The benefits of face covering for preventing transmission of COVID-19 are derived from the combination of its role as both source control and providing some degree of personal protection for the wearer. Paragraph I requires employers to ensure that each employee who is not fully vaccinated wears a face covering when indoors or when occupying a vehicle with another person for work purposes. OSHA uses the same definition of face covering that has been used by the CDC. That is, a face covering means a covering that completely covers the nose and mouth of the wearer, excluding a face shield, which is made from 2 or more layers of breathable fabric that is tightly woven and is secured to the wearer's head with ties, ear loops, or elastic headbands that go behind the head, and is a solid piece of material without slits, exhalation valves, visible holes, or other openings in the materials. Face coverings can be either manufactured or homemade, and they can incorporate a variety of designs, structures, and materials. Face coverings can be disposable or reusable, and under this ETS, face coverings do not have to meet a consensus standard. Unvaccinated employees are not required to wear a face covering when alone in a room with floor-to-ceiling walls and with a door that's closed, for a limited time while eating or drinking, for a limited time for safety and/or security identification purposes, when wearing respirators or face masks, and when the use of a face covering is infeasible or creates a greater hazard. Paragraph I-2 requires that employers ensure that any face covering required to be worn by this section is worn by the employee so that it fully covers the employee's nose and mouth and is replaced when wet, soiled, or damaged. For example, if the face covering is ripped, has holes, or broken ear loops. To be worn properly, the face covering must completely cover the wearer's nose and mouth and must fit snugly against the sides of the face without gaps. The employer must also not prevent any employee, regardless of vaccination status, from voluntarily wearing a face covering or face mask unless the employer can demonstrate that doing so would create a hazard. Similarly, the employer must permit the employee to wear a respirator instead of a face covering, whether required or not, and the employer may provide the respirator to the employee even if not required. While vaccination greatly reduces the risk of the most severe consequences of COVID-19 to workers, it does not reduce the risk to zero, and thus workers must be permitted to wear face coverings, face masks, or respirators, even when not required to do so, in order to allow the worker to further address this residual risk. If the employer chooses to provide a respirator, the employer must also comply with 1910-504, the Mini Respiratory Protection Program. The Mini Respiratory Protection Program is designed to strengthen employee protections with a small set of provisions for the safe use of respirators. Lastly, the employer must not prohibit customers or visitors from wearing face coverings. This provision is necessary because increased use of face coverings also reduces the overall risk of COVID-19 transmission from customers and visitors to workers, both unvaccinated and vaccinated alike. Additionally, it allows customers and visitors to protect their own health and safety. Topic 3 of this webinar addresses information that must be provided to employees. In order to successfully implement the provisions of the ETS, it is critical that employers provide relevant information to employees. Paragraph J requires employers to provide employees with information about the ETS, workplace policies and procedures established to implement the ETS, COVID-19 vaccine safety, efficacy, and benefits, protections against retaliation and discrimination, and potential penalties for knowingly providing false information to the employer or to OSHA. The manner in which employers provide the required information to employees may vary based on the size and type of workplace. However, such information must be provided to each employee in a language and at a literacy level that the employee understands. When an employer's policies and procedures change, the employer must provide any updated or supplemental information to their employees. Topic 4 in this webinar addresses the reporting and record-keeping requirements of the ETS. In order to address the unique circumstances presented by COVID-19 and to facilitate OSHA investigation and better workplace health surveillance, Paragraph K requires covered employers to report each work-related COVID-19 fatality to OSHA within 8 hours of the employer learning about the fatality, and to report each work-related COVID-19 inpatient hospitalization to OSHA within 24 hours of the employer learning about the inpatient hospitalization. Under this paragraph, an employer must make a report to OSHA within 8 hours of learning both 1, that an employee has died from a confirmed case of COVID-19, and 2, that the cause of death was the result of a work-related exposure to COVID-19. Employers are only required to report the fatality of confirmed cases of COVID-19. OSHA has chosen not to apply the 30-day limitation period from 29 CFR Part 1904.39B6 to the reporting provision in Paragraph K of this ETS. Therefore, the requirement to report these fatalities is not limited by the length of time between the workplace exposure and the worker's death. Under Paragraph L, the employer must make available for examination and copying the individual COVID-19 vaccine documentation and any COVID-19 test results required by the ETS for a particular employee to that employee and to anyone having written authorization and consent of that employee by the end of the next business day after the request. The employer must also make the aggregate number of fully vaccinated employees at a workplace and the total number of employees at that workplace available to an employee or an employee representative on request. Employers will be able to utilize the roster of each employee's vaccine status that they are required to maintain under Paragraph E4 of the ETS to provide this information promptly to a requester. Employers must provide the written policies required under Paragraph D and the aggregate number of fully vaccinated employees at a workplace and the total number of employees at a workplace to the Assistant Secretary of OSHA for examination and copying within 4 business hours of a request. All other records and documentation must be provided to the Assistant Secretary of OSHA by the end of the next business day after a request. OSHA has developed a number of fact sheets and compliance assistance materials to help employers comply with this ETS, including model policies and information that can be used to fulfill the requirements for information provided to employees. Enforcement policies and helpful FAQs have also been provided. All information can be found on the OSHA website at www.osha.gov/coronavirus. Thank you for watching this OSHA webinar on the COVID-19 Vaccination and Testing Emergency Temporary Standard.